Okay, hi, I'm Kaylee.
I'm Alex.
And we have a DKA new diabetic teaching that we're going to be doing. So it's a 42-year-old woman. She comes in lethargic, disoriented, flushed, nausea, vomiting, and she's had the flu for the past couple of days. She's reoriented and able to provide teaching too.
Okay.
All right. Knock, knock, knock.
Come in.
Hi, I'm Kaylee. I'll be your nurse today.
Hello.
I'm going to talk to you about some discharge teaching because you're going home, and we want to make sure that you have all the information since you're newly diabetic.
Okay.
Do you know anything about your diabetes?
No.
I see that you have.
Sick.
Yeah, I see you have a family history of diabetes. Your parents have it.
Mhm.
Did you ever watch them in their normal daily routines?
Not really. I really didn't pay attention.
No. Okay. Well, today we're going to teach you all about it. Okay. What we're going to first start with is the fact that we're in DKA, which is it happens when you're not managing your diabetes well and your blood sugar spike to 300 plus, and you have ketones in your urine, and you can become lethargic and disoriented and have nausea and vomiting. So next time you feel that way, you need to come in immediately because it is an emergency. And that all can be prevented by checking your blood glucose. We're going to show you. You do it with a glucometer, and it's going to come with dextrose strips. And you got to calibrate it. So I'm going to show you first, and then you're going to do it, okay? So you're going to put the sticks in here, and then you're going to calibrate it. And then you're going to take this little, what did you call it?
Dextrose stick.
No.
Oh, the Lancer.
Okay, then you're going to take the Lancer, and you're going to, after you swipe with alcohol on your chosen finger, whichever one you want to do, on the side, don't do it on the pad of your finger,
Right.
on the side. And you're going to squeeze it, rub the alcohol, poke it. When you get the first flash of blood, you need to wipe it because that's going to have alcohol and that'll mess up your reading. So you're going to wipe it, squeeze more, then you're going to put it back on the glucometer, and it's going to read. It's going to tell you a number. So now I want you to do that,
Okay.
and then I'm going to explain what the number means.
Okay. So I'll put that little strip here, and then I'm gonna take my alcohol. I'm gonna rub on my finger. Then I'm gonna take the little Lancer thingy, and I'm gonna go right here.
No, on the side.
Okay, right there.
Yes, there you
And
go.
I'm gonna poke, and then I squeeze, and I take my gauze, wipe it, and then I take my thingy and go right there.
Yep,
Okay.
perfect.
So it's thinking.
All right. It says your glucose is 273, which is very high.
Okay.
So when you get a reading, then we're going to use this wonderful little scale. It's called a sliding scale. You're going to look at it, and whatever your number is on that, you're going to draw up an insulin.
Okay.
Insulin's going to help control your blood glucose. It has to go through an injection, but the needle is very small. It won't hurt. So I'm going to show you how to do insulin now. So you're going to take your insulin vial and your needle. It has to be an insulin needle. We'll provide these with the... you're going to take an alcohol swab and rub the hub. Then you're going to uncap your needle, stick it in, push it upside down like I'm doing. There might be air bubbles. And then you're going to draw back however many units that scale told you. Remember the scale? All right, we're going to draw it back when it said 5 units. And we're going to put it back down, pull it out, and cap it. You don't want to poke yourself. All right, and then afterwards, you're going to choose a site. It's going to be a fatty site, your arm or your belly, back of your arm, not the front of your arm, the back of your arm. And when you're going to scrub that with alcohol, pinch it, uncap this, and inject. No rubbing afterwards. Dispose of the needle. Do not use the needle again.
Okay.
Okay, you need to make sure that you swap sites every time.
Okay.
Okay, now I want you to do it. I need you to draw 5 units up.
Okay. So I take my alcohol, I clean the hub, I take my little needle, and I take the cap, and then I go there, and then I have to flip it, correct? And I flip, and then I'll hold it, and I pull, and you got 5. And then I take it out, okay, and then I'm gonna close my cap, okay.
All right, now choose a site.
I'm going my belly.
Belly, okay.
Okay, so I'm gonna squeeze it, and I'm gonna rub, and then let it dry, and then boop, and then press.
Perfect.
Okay.
Alrighty. we got the insulin down.
Mm-hmm.
Now I'm going to teach you about signs and symptoms of when you have too much blood glucose and when you have too little. It's called hypo and hyperglycemia, and it's important that you manage that. So when you have hypoglycemia, you might feel really, like tired and jittery and just like not with it. You need to take your blood glucose. And then if you have a low blood glucose, which is less than 70, I need you to eat something sugary. Get it up. Sit for 15 minutes, see how you're feeling. Check your blood glucose again, okay? And for hyperglycemia, you're going to be like really thirsty, really hungry, and you're going to be like peeing a lot. And so you're going to check your blood glucose. Anytime you don't feel good, you're going to check your blood glucose. Anytime you eat a meal, right before, you're going to check your blood glucose. Because that's going to determine what you need to eat and what you don't need to eat.
Okay.
All right? Do you understand?
Yes, ma'am.
Do you have any questions?
No, it's a lot, but I'm getting it.
Okay. Now we're going to talk about your diet. What is your normal daily routine?
Oh, I love my Starbucks. I love my chicken nuggets, my hamburgers, my, also Starbucks, yeah.
Yeah? What do you eat from Starbucks?
It's Frappuccinos, man. They're so good.
You say you have one daily?
About 2.
2 day?
3, maybe.
Okay. So those are all high in sugar, and that's going to contribute to your high blood glucose, and that's kind of why you're here. So we're going to give you a list of foods to avoid. I'm going to give you all of these.
Okay.
You don't necessarily have to cut them out of your diet, but you really do need to make sure you're monitoring that blood glucose. If you have high...
My ice cream?
Yeah. If you have high blood glucose, you don't need to be eating these. You need to cut them out for the day. If you have low blood glucose, I'd say you can have soda, bump it up,
Okay.
And then I'm also going to give you this. This is my plate. It's going to tell you each proportion size and how much you should have of it. You can also go to myplate.gov, and it's going to have even more information for you about maintaining the proper proportions.
Okay.
I really want you to start to give me a food journal so we can work with the dietitian. That means every day you're writing down what you're having for breakfast, lunch, and dinner. Your normal everything. You're going to come back, follow up, and then we're going to help modify your diet. Okay? I'm also going to give you this big old pamphlet with everything you need to know about diabetes. It's going to have a number for your doctor. It's going to have my number. It's going to have a dietitian's number. If you have any more questions after today, you're going to call that number. We will be here to help you. Okay? I feel like I'm missing something.
I think you're pretty well-rounded, nurse. I really appreciate it. But I will keep practicing my injections.
All right. Well, you tell me what you've learned today.
Learned how certain food to avoid to prevent my sugar from spiking. How I have to modify my diet so I can get healthier and maybe lose the weight, and also a little bit about the disease that I have, that diabetes, and how I have to control it, and to follow up with the doctors and
that is very important. You haven't seen a care provider in 4 years, and it's very important. Now that you're diagnosed with diabetes, you need to have follow-ups regularly. We need to make sure you're managing it. Okay. One last thing about the diet, and then if you don't have any further questions, we'll continue with the discharge. So I want you. Have you ever read a food label before?
No.
You don't pay attention to the food labels?
Not really.
Not most people don't, but that's okay. We're going to teach you. It's important to know how much sugar, because back to what I was saying, it's going to spike your blood glucose. And if you have too high or too low, it's going to contribute to your symptoms. So I want you to read on this bottle of Nutella where the sugar is.
Oh my God, it's like right there, like 65 grams.
65 grams of sugar. Well, the way that sugar works and how much you should be regulating it is depending on how many calories a day you have, it's going to be 10% of your daily intake. So let's say you're taking 700 calories a day, 70 grams. That's it. That's all you have.
No more for the day?
No more for the day. So that's that Nutella. That's it.
That's it.
No more sugar. So no soda, no
Starbucks.
No Starbucks.
Man.
It's important. So you're also going to be discharged with 2 different types of medications. Ibuprofen. Have you ever taken that?
It's for pain, right? Yeah,
Yeah.
I think I took it before.
Are you aware of any of the side effects that come with it?
I know you have to take it with food, and you kind of make a stomach upset.
Yeah, if you don't take it, if you take too much or not with food, it can cause your stomach to be upset, or it can cause ulcers. So
Yeah.
please be careful. Take
Okay.
it only as needed every 6 hours. How about metformin?
No.
So that's a diabetic medication. It's going to help you regulate your insulin in your body. It's going to be 500 milligrams by mouth twice a day. The side effects of that you want to watch out for is nausea and vomiting. If you have any of this, you need to call the doctor right away. Then we can put you on something else or find a way to make it work.
Okay.
But it's important you take that. You don't skip a dose.
Mm-hmm.
Even if you don't feel good, you take it.
Okay.
Okay?
What if I feel good?
You still need to take it.
Okay.
Twice a day.
Okay.
Doesn't matter. Any day of the week. Christmas, your birthday, you're taking it. Okay? Anything else? We talked about the
Okay. That's just
the
that's
sliding
another
scale.
diabetic, you know.
Yep.
Yep. Okay.
Alrighty.
Yep. I think I'm good. Thank you for information, Ms. Nurse.
Of course. And we hope to see you back for your follow-up appointment with your food journal.
Yes, ma'am. Okay.
Alrighty.
Thank you.
Thank you.